Okay, and now time to talk about the two diseases I chose to talk about that affect the nervous system in the second part of the video I just made and will be sending first. So the first one I'm going to mention is the one with the harder name, amyotrophic lateral sclerosis. Sounds about right. This disease is the degeneration of nerve cells in your spinal cord and nerves that run to limbs, arm, leg. This disease causes the breakdown or inability of these nerves to function, and this can start, as most patients report, trouble walking, running, grabbing for things, and occasional muscle weakness as well. Though this disease progresses, not at a very fast rate, but it'll keep getting worse and worse until most patients, all patients, will eventually need to be put into a wheelchair, and the disease will slowly progress until the patient can become completely paralyzed, and as it progresses further, it can start to infect involuntary muscles. It is noted that most patients die actually from respiratory failure, since they lose the ability to control the muscles in their chest that allow them to breathe. Dark. But they say there is no cure for the disease as of now. They haven't found any sort of genome to link it to, though it is noted that symptoms, if they do appear, they most commonly appear between the ages of 40 to 60. It is more prone to affect men, but of course affects both genders. Like I said, as of now, there is no cure, so the best way to prolong it is just to be put on life support for as long as that can help. That's all for that one. The second one is one that most people know about and have heard about, Alzheimer's disease. This is the slow degradation, shrinking, loss of function of the brain itself. Alzheimer's affects mostly older people, though it can affect younger people, though they'd know what genes will cause it to happen in younger people. Older people, it can be related to genes, though there are probably other methods or other ways that just haven't been identified yet. Alzheimer's disease, like I mentioned, is degradation of the brain itself. This can cause all sorts of problems with senses, thought, memories, recollection of memories, motor skills, and this is a progressive disease. As of right now, it sadly has no cure, and it will continue to progress until eventually either the brain shuts down or control to one of the vital organs stops, and that causes death as well. Symptoms can widely range. It'll affect your thinking, your behavior, your ability to form memories, and in most cases, your movement, muscle control. Again, sadly, no cure, though in younger people that have it, they have identified genes that are responsible for causing it, so hopefully they can figure out a cure soon. This will be submitted in part with the first video for the anatomy exam grade. Hopefully I do well.